Hello, it's your host for today, Henry Acosta. Thank you for tuning with us and welcome to Health Professional Radio. Today we have Dr. Richard Kidd. He is a clinician who regularly treats people with addiction on opioids and prescribed painkillers. We're here to talk about the International Overdose Awareness Day and what he's trying to achieve with the organizations he's advocating, such as Scriptwise and Turn to Help. Hi, Richard. Good morning, and how are you?
Hi, I'm not too bad. And yourself?
I'm good, thank you. And how did you get into your practice, and how long have you been doing it?
Um, I've been a general practitioner for over 30 years, and I've had a long-standing interest in mental health, chronic disease management, which also includes, of course, chronic pain. And as any GP, I also often have to deal with situations in which people have acute pain from injuries.
I see. And how did you start getting involved with organizations such as Scriptwise and Turn to Help?
Over the last several years, I've become increasingly involved in national government committees for a range of things. A national prescription service for aged care facilities, trying to get a standardised medication chart that can be used across all of the facilities, and something a bit like is used in hospitals. Done a lot of other work on things for Departments of Veterans Affairs, palliative care in particular. I've been on Palliative Care Australia's national committees, particularly around the palliative approach in aged care facilities. Through the Australian Medical Association, I've been involved in various committees that work towards developing policy and position statements on to support doctors and others in various aspects of health surgery, including prescribing of opioids and benzodiazepines and other medications that carry risks.
I see. And well, what I have here so far is Scriptwise is looking to get the national real-time prescription monitoring system mandated all around Australia. What is the real-time prescription monitoring system, and why is it needed to be implemented nationwide?
A real-time monitoring system is one where it might be easiest to give you an example. Imagine a person who is going to more than one doctor and maybe more than one health service, like emergency departments or whatever, and getting prescriptions for a strong opioid or maybe benzodiazepine. And now, with real-time monitoring, if that person has gone to a pharmacist 5-10 minutes before his appointment with one of those prescribers, with real-time monitoring, the prescriber will be able to see, this person's just gone and got a prescription filled for these things, and may well then be able to start a conversation and say, look, I can see you've just had a prescription filled. Can we talk about this? And it provides an opportunity to perhaps help a person in the stages of maybe becoming addicted. Medications like opioids and benzodiazepines often create dependency in people, but dependency isn't the same thing as addiction. Addiction is where the person's behaviour changes and they start trying to get more of the medication than is really safe for them, and they might start going to more than one doctor or prescriber to get it. And that's where real-time monitoring can help us intervene early in a constructive, helpful, supportive way, and help people not go down a bad path where many sadly die.
Oh, that sounds great, and I hope that it gets implemented soon. So can we talk about the International Overdose Awareness Day, and how can we get more info on it?
The International Overdose Awareness Day is a really important focus each year, and if you think of the sorts of things I just said, to put some names to the sorts of accidental overdoses that have happened where people have not realised that they are taking too much, or perhaps taking something else that they shouldn't take with it, like alcohol. There have been tragic outcomes, and we can think very recently of Prince, Michael Jackson, Heath Ledger, a number of very high-profile, very creative people who were contributing so much to our society and were sadly taken from us through an accidental overdose. And the International Overdose Awareness Day really helps focus us on how does this happen, what can we do to prevent such tragic loss.
I see. And what are the steps that we can do to help raise awareness for International Overdose Awareness Day and substance abuse?
I think if we can help people understand that there are all sorts of medications that can lead to some dependency and then bigger problems, that would be the most important thing. I think the average Australian doesn't realise that when they go and buy things from the supermarket or over the counter at the pharmacy that have got codeine in them, they could end up becoming dependent. And we see problems even from people just buying those sorts of medicines over the counter, and they end up needing to take more and more and more to get the effect that they want from the codeine, not that they understand that that's what's happening.
Yeah.
And then they get poisoned by the other things that are in those medicines, whether it's paracetamol or whether it's an anti-inflammatory, and that can sometimes kill them as well. So we need to really help people understand that medicines, even the ones you buy over the counter, have risks, and people really need to understand what it is they're taking. And they should really talk about medicines with their doctors, understand what it is, how it's supposed to be used, what they can expect in terms of benefit, and very much they need to understand what the risks are and how to manage the medicine safely and what things they can and can't take with it. Often they should not take alcohol with it.
I see. And so are there certain degrees of addiction that an everyday person like me would not be aware of? And if ever, is there a way to identify them?
Well, yes. I think the best way to identify them is I would love to see those things that contain codeine actually taken off of the over-the-counter access, and maybe even over-the-counter in the pharmacy access, because I think all too often people have no idea, and we need to have an opportunity to inform people about what these medicines really do and what some of their harms might be. And so that means really putting it back into a doctor-patient interaction, because the doctor is the best person to say, look, I'm prescribing this for you because I want it to do this and this for you, but you do need to be careful because it could also do these other things, and it can sometimes create problems around dependency and even addiction. So we need to work on this together and stay in touch. And it's that collaborative approach that will keep a lot of people safe.
All right. And what do you think is the best way to treat addiction to those already addicted or dependent on prescribed substances?
The first thing is helping people understand that they actually do have an addiction and that it's something that they can be helped with in a non-judgmental, supportive, constructive way. The example I gave before of people just buying one of these compounds over the counter that's got codeine and some other medicine in it, a lot of people wouldn't realise that they've actually become addicted, that they're buying a large amount of it week by week. And they need to actually come to understand that there is an issue there, that there's something they're doing that could have a very bad effect on their health. So there's that level of addiction, which is not the sort that gets people into trouble with the police. But then you've got at the other end of the scale people who have become severely addicted to quite often opioids and sometimes benzodiazepines, and their behaviour can change to the point where they are breaking the law to either get hold of these sorts of drugs illegally, or they are breaking the law by going to multiple prescribers and getting medicines that have got very, very tight regulations around them. And by not being honest with the prescribers, they are doing themselves a disservice, and also possibly the prescribers. If the prescribers are not taking proper care, they risk losing their medical license or their pharmaceutical license. It's an area that we all have to be very careful in. But there's a range of ways of helping people who've got addiction. There's, as I said, the low end of the scale, and quite often just realising that they have become dependent on something. A lot of people are able to just stop. So not everyone needs to go and see an addiction specialist for help, but there are people who have got very severe difficulties trying to stop behaviours that are going to get them into trouble. And they really benefit from seeing a addiction specialist, particularly one that is involved in a team that have got like psychologists, social worker, other people that can help the addicted person in a variety of ways, because sometimes the addiction isn't just about the medicine. The addiction can be because of a variety of other things going on in that person's life that they could be helped with.
I see. And so what would you like our clinical audience to know as a result of this interview?
I think it's very important that clinicians as well as the public have a much greater awareness of the extent of the problem. That when we talk about people dying from overdoses in Australia, and 4 Australians do die each day from drug overdose, more than 4 out of 5 of those deaths involve prescription medicines. So clinicians need to be always mindful when they're prescribing any opioids, including the lower strength codeine compounds and benzodiazepines. And we need to approach our patients in a caring, non-judgmental, supportive way to help inform them and support them if they are starting to have difficulties. And hopefully by having that kind of open approach, we may prevent a lot of dependency and addiction.
All right. And what's the biggest misconception on what you guys do, and what are your responses to these misconceptions?
I think the biggest misconception is that the real-time monitoring program would in some way become punitive, particularly for the clinicians who are prescribing. That's not the intent at all. If we have a good real-time monitoring program, it's an early warning system that aids the clinicians to provide the best possible care. It's not about punishing clinicians. It's about giving them information in a very timely way so that they can better assist patients who might be not fully disclosing the extent to which they're going to other doctors and prescribers. It may well have saved the life of someone like the Toowoomba nurse, Katie Lee Howman, where the coroner found that the GP was prescribing appropriately, but had no idea that she was obtaining opioids from many other prescribers, more than 30. Real-time monitoring would have given that GP and the other prescribers early warning, and she might have been given some help that might have put her down a different path, and she might not have died. The other thing that clinicians should know about is the website turntohelp.com.au. It's a very useful website for clinicians and particularly for patients.
I see. And can you give us details on how our listeners can get in contact with you?
With me? Certainly. I'm one of the newer board members of Scriptwise. I'm a general practitioner in Queensland. My surgery is the Nunda Doctor's Surgery. People can either contact me through the surgery, which is 0732668488, or email me on richardkidd@me.com. So it's RichardKidd.com. Sorry, I'll say that again. RichardKidd@me.com.
And for our last question is, how can you give us details on how to sign up for the organizations such as Scriptwise and Turn to Help?
Scriptwise has got a website that's very easy to find, and it would be great if people join up and support Scriptwise. there's a lot of work to be done to actually achieve real-time monitoring that is interoperable across all of the states and territories. The federal government passed an act in 2010, but the states have still got to make some legislative changes, and we need some investment to make this happen. And the sooner we can make it happen, the better for our patients and for us.
You've been listening to HPR, and our guest is Dr. Richard Kidd. He is a member of the organizations such as Scriptwise Internal Health. He is also a clinician who treats people who are dealing with problems and substance abuse. It's been great having you here, Richard.
Thank you very much.
And to everyone out there listening, thanks for sticking with us. We have transcripts and audio available on hpr.fm, and you can listen to our podcasts on iTunes.